Good afternoon and welcome to Coffee with Casey, my live Medicare training series held every Wednesday at 3 p.m. Eastern Time. And let's start with this. Most people don't make the wrong Medicare decision because they don't care. They make it because they overthink it. Too much information, too many options, too many what ifs, and instead of clarity, they end up stuck or they end up second guessing themselves. And that is what we're going to fix today. For those of you who don't know me yet, my name is Casey Album. My family has been helping people navigate Medicare for over 30 years. And one thing I hear all the time is, I just want to make the right decision without feeling like I'm missing something. Because before we talk, most people feel overwhelmed. They've Googled, they've talked to friends, they've watched some videos on Facebook or Instagram. Maybe they've even spoken to someone already, and they're still unsure. Many of my clients refer to me as their Medicare co-pilot, not just because I fly, I am a licensed pilot, but because I help them simplify this and I map it out. Just like when I'm planning a flight, and then I'm right there with them every step of the way at enrollment, when things change, years down the road. My clients aren't guessing because they've got a plan. So today I'm going to simplify this for you. We're going to talk about how to choose the right Medicare plan without overthinking it. This isn't about giving you more information. It's about giving you the right way to think about the decision. Think of it as a way to cut through the noise and focus on what actually matters. And this is Coffee with Casey, so grab your coffee and let's get into it. Write simple in the comments if you are ready to simplify this. So first, choosing the right plan starts with the right framework. Most people jump straight into what's the best plan, how much is the premium, or what's the cheapest option. But that's backwards. The better question is, what do I want my experience with Medicare to look like? Not just for today, but 5 or 10 years down the road. Do you want flexibility with doctors and hospitals? Do you want predictable costs, simplicity, control over your healthcare decisions? Because once you're clear on that, then the right plan becomes a lot easier to identify. Clarity makes the decision simple. Write yes if that makes sense. So second, you want to focus on the parts that actually matter, not everything. There's a lot of noise out there, isn't there? I mean, you see ads on TV, your mailbox, if you're approaching 65, is getting stuffed with mailers, and everything is promising all kinds of benefits. It's really hard to know what's true and what's actually facts as opposed to marketing information because it all uses the word Medicare. So overthinking comes from trying to evaluate every single detail or benefit. But most decisions really come down to a few key things: how you'll access care, that's structure, how you'll manage costs, and how important flexibility over time is to you. Everything else is secondary. I see people get stuck comparing 10 different plans when the real decision was already clear once they focused on the things that mattered most. You don't need more options, you need better filters. Write me if you've ever felt overwhelmed by having far too many choices. And then the third key is to choose a plan that works long term, not just for today. This is where I see so many people go through all of the steps correctly. They get their enrollment timing right to avoid penalties. They sign up correctly with Social Security with the right paperwork. And then they choose a plan based on features and benefits or what looks cheaper today, thinking that just like with their work plan, they can change every year if they don't like it. But Medicare doesn't work that way. A couple of weeks ago, I spoke with a really nice lady who called the office for help. She started on an Advantage plan when she turned 65. She lives over on the West Coast, just outside of Tampa. She was healthy when she signed up. It was a zero premium plan. She didn't want to spend money and she thought it would work great. She was healthy. But a few years later, she was now fighting stage 4 breast cancer. Moffitt Cancer Center, great cancer center over in Tampa, that's where she was getting her care. Well, guess what happened? They stopped taking her Advantage plan. Again, those are managed care plans. They have networks. They can change at any time. And so she wanted to switch to a different plan, but because she already had cancer, she didn't qualify for a Medigap plan that would have let her keep getting treatment at Moffitt and with her current oncologist. She had to go in the middle of treatment and find somebody else to treat her. And that can be frustrating. So the real goal is to choose something that holds up even when things change. And they will. Your health changes as you get older. Doctors can change. Doctors retire. Doctors are in and out of networks all the time. All of that can change. And your priorities can change. Maybe you're moving. Maybe you want to be more active. Maybe you want to travel more. Maybe you want to spend the summer up north with your grandkids. So instead of asking, is this perfect? The real question to ask is, will this plan still work for me 5 to 10 years down the road? And that is how you make a confident decision without second guessing. The right decision is the one you won't have to try and redo later on under pressure. Right value if this is helping you simplify things. And if this is helping you cut through all the noise, well, good, because that's the goal. Because most people don't need more information, they need clarity. And remember, your situation is unique. There is no one size fits all approach to Medicare. And how many times have we all seen people that they've copied a friend's Medicare plan because a friend insists that this plan or that plan is the best? And it very well might be for them, but every situation is different. You have different priorities, you have a different budget, you have different travel plans, your health is different. And that's where I come in as your Medicare co-pilot, because my job is to sit down with you, help you really map this out. My job is to understand your needs and then help you put together a plan so that you can make an overall Medicare strategy decision confidently without overthinking it. And if you'd like help with that, just drop help in the comments, or you can go to medicarequotes.com/Facebook, set up a quick call with me and I'll be glad to walk you through it, or call the office 954-970-4760, and we'll be glad to get you on the calendar with me, with Nick, with Cyan, and walk you through it. So now I want to go through some common questions that I typically see as I'm helping people with Medicare. These are very common questions, come up in almost all my conversations. First one, very common: how do I know which plan is right for me? And I have to answer that question with a few questions. First is, do you have doctors that you're going to want to be able to continue to see? Or is there a hospital or a treatment facility that you want to have access to? What happens if, or what would happen if they didn't take your plan? That lady in Tampa that I was speaking to, I felt horrible for her. She found out and it was really too late for her. Do you travel? Do you want a plan that travels with you? My dad and my stepmom, Donna, they're here half of the year and they're up north half the year. And they have a plan that travels with them. So when they're up north, if they need to go to the doctor, works the same way as it does here. They don't have to worry about having to fly home just to see a doctor who's in the network. Are you comfortable begging your primary care physician for referrals? Or are you comfortable waiting for an insurance company to pre-approve your tests or treatments at a time when really time could be of the essence? Are you comfortable trading less freedom and flexibility and more pay-as-you-go exposure in exchange for lower monthly costs today? These are all important questions, and how you answer them is going to determine which plan structure is going to be right for you. Another big question that comes along with that is, what if I make the wrong decision? Well, if you make the wrong decision and you choose a Medicare Advantage plan, the annual election period between October 15th and December 7th of each year allows you an opportunity to basically get a do-over, but there's some caveats, because you'll be more than 6 months since activating your Part B coverage in most states. If you don't qualify health-wise, you may not be able to get a plan. You may be stuck on a Medicare Advantage plan. Now, there are some limited trial rights for people who sign up for Advantage at 65 and want to get out of it within a certain period of time. But as a general rule, the key window is 6 months from when your Part B coverage is activated. That's when you have all your options on the table. And if you've watched some of my other live trainings, you know that I talk about at age 65, all your options are on the table. You can get any plan from any company without having to answer health questions. And that means essentially you get to evaluate Medicare. But later on, outside of that 6-month window for Part B, again, in most states, I know there are some exceptions, Medicare gets to evaluate you. And that means that certain options are no longer available, like that nice lady that I spoke to found out, or it may cost you more because now you're a few years older. Most people who choose Medigap or Medicare supplement at age 65, they end up keeping their plans for the long term because those are plans that are built for the long term. I mean, all you have to do is pay your premiums and your coverage is going to stay in force. If you travel, the plan's going to travel with you. Your benefits can never be reduced. And it offers much more flexibility, much more predictable cost. So for a lot of seniors, especially folks who are on a fixed income, that can be the way to go because it can protect your retirement savings for the long term. And a question that comes up on almost every Medicare planning call that I host, or every Medicare Made Simple workshop that I run, is what would you recommend to your own mom if she was starting Medicare? And that's actually an easy question for me to answer because my mom is on Medicare. She lives in a rural area. There's a limited number of primary care physicians there. She's got a couple of specialists that she had to be able to continue seeing for some chronic issues. And my mom's on a fixed income. She's got a very small retirement plan and she's got Social Security, and that's a key part of her strategy. So for my mom, protecting her income and protecting her from surprise out-of-pocket costs was critical. And keeping her specialists, making sure she had access to her primary care doctors, that was also critical. So for her, a Medicare supplement, Plan G, was the way to go. And yeah, she's got a premium, a couple $100 a month. Nobody really wants an extra monthly premium, but my mom can budget for that. And she never has to worry about being surprised with $5,000 to $7,000 out of pocket like she would on an Advantage plan, or more if one of her providers was out of network. And that gives her real peace of mind that her retirement income is going to last. And now that she is here in Florida with us, her Medicare supplement plan moves right along with her. She can make appointments and go to doctors here just like she does at home. And when we were sitting down and mapping out her Medicare strategy, we knew that there was a distinct possibility that several years later she'd be spending a lot more time in Florida. So that was also a key part of determining which plan was going to work well for her. And having that Medigap plan for her was a key part of her strategy. Thank you for joining me for today's Coffee with Casey. If this helped you simplify things, well, that's exactly what it was supposed to do. If you'd like help or want to talk one-on-one, you can go to medicarequotes.com/Facebook and you can book an appointment with me. You can call the office at 954-970-4760 or just drop help in the comments and I'll be glad to point you in the right direction. And if you know someone who's stuck overthinking their Medicare decision, this would be a great one to share with them too. I'll see you next Wednesday at 3 p.m. for next week's Coffee with Casey. Have a great day, everybody.